March is DVT Awareness Month, and I'm here with Dr. Todd Jones of Inovia Vein Centers to tell me more about the condition. So, doctor, what is DVT and what is this condition all about?
DVT stands for deep vein thrombosis, which essentially means a clot in the deep veins of either the leg or the upper extremity.
So then, what are some of the signs or symptoms of this condition?
Well, the cardinal signs and symptoms typically are pain of the lower extremity, redness or swelling, particularly behind the calf. It can occur in almost anyone. It can be a scary condition. It can affect up to 900,000 people per year and cause somewhere around 100,000 deaths per year.
There is high risk and low risk elements to this condition. Tell me more about that.
Certainly. So things that predispose an individual to deep vein thrombosis can be things as simple as taking a long flight. Traveling more than 4 hours in a plane is actually a risk factor to deep vein thrombosis or DVT. Having had recent surgery or breaking a bone, particularly in your leg, can predispose you to deep vein thrombosis. Cancer can cause clots or predispose somebody to it, as well as genetic conditions that can cause it.
Tell me about how you can treat and diagnose DVT.
Well, first thing we do is always starting with physical exam and interviewing the patient. Physical exam, so we're looking for tenderness and swelling around the ankles or behind the calf, or maybe specific tender and swollen red spot on the leg. And then for interview, we typically look for somebody who's had recent trauma or had a recent surgery, or maybe they've been on a long flight or a really long bus ride. And then when we move on to diagnosis, for clinical studies, we do imaging studies like ultrasound, where we can visualize the veins specifically and look for clots inside of the veins.
So how is DVT treated?
Well, after we establish the diagnosis, typically we start with compression stockings, which is a major thing to help decrease swelling and help improve symptoms and speed along recovery. And then we move on to close observation and possibly even anticoagulants or blood thinners, depending on the specific patient and where the clot is.
Okay, so this is just one of the many conditions that Inovia Vein Centers treats or diagnose. So tell me more about that.
So other things that we treat and diagnose at Inovia Vein Centers are things like varicose veins and spider veins, as well as venous stasis ulcers, which can be a long-term consequence of DVTs, actually, as well as leg swelling and pain in the lower extremity. And we treat those all with minimally invasive techniques that are all outpatient and very safe, and we do it in the office.
Okay, so tell me about the different locations.
We have a location in Bend. We also have an office in Northwest Portland, which is where I practice. And then we have offices also in Happy Valley, Tannisbourne, and Bridgeport.
Okay, well, this has been so informative. Thank you so much for talking with us today.
It's my pleasure.
Learn more about our providers and treatments or book your consultation online at inoviavein.com.